deliver letters from branches across the state to the Premier asking him to reconsider his position on ratios for the safety of patients across New South Wales. It's clear to nurses across the state that this government is intent on not improving ratios, despite evidence to the contrary saying that ratios work.
I feel betrayed, I feel hurt, I feel angry that he hasn't taken any of what we said seriously. I gave him many examples of what it's like to be a paediatric nurse in a tertiary hospital, as well as in a rural hospital, as well as in a peripheral Sydney hospital. What it's like to be a paediatric nurse and not be able to do the kind of patient care that you want to do.
Out of 18 beds, we probably change over 11 or 12 every day, so that is a huge workload. And we have like stroke and dementia patients as well. And you sometimes get this terrible feeling that you really haven't done enough for these patients.
From the nurses of New South Wales, these are some letters written to Mr O'Farrell and to the O'Farrell Government requesting that he reconsider ratios for the public health sector. We've also supplied him with a cup because nurses are the heart of healthcare, and some coffee, okay, because we do realise that this will take some time to read. Okay, and thank you so much.
No, that's my pleasure.
I don't think they feel that the citizens of New South Wales are important enough to care for.
And if he truly can look into their eyes and say, you're getting the best care we can have.
We put in a claim some months ago for an increase in ratios to improve our patient safety. We got a response back from the government, and what did the government say? No, we're not prepared to increase your ratios, we're not prepared to increase your wage claim, we don't care about patient safety. We've sent a letter to Mike Baird asking him to explain why he is happy to have a two-tiered, unsafe public health system. We asked for a response by 12 midday yesterday, and we got absolutely and utterly nothing. The government does not care about patient safety. We've been in to see Mike Baird. He was not able to come out and talk to us. He is not prepared to talk to you, the local members of the community, about safe patient care and improving ratios.
Shame, Mike, shame! Shame, Mike, shame! Shame, Mike,
We continue just to get more and more clients. On an average evening, we have 14 clients to see on our busier nights. Those clients need to be seen in 200 minutes. That gives me 14 minutes per client. That includes drive time, parking time, going up 3 flights of stairs, and then having to do it all again. So that gives me 1 minute face-to-face time with a client.
Nurses are a pretty courageous bunch, and we'll only be pushed so far, and we always put patient safety first. We thought she was going to be here, but they vacated the whole office, gone out to lunch. I think the whole government's out to lunch on the issue of safety and patient ratios.
These people in regional New South Wales and in country areas, they really need our support. They're working with a lot less staff than us, and in a lot of these areas they're looking after the same amount of patients with the same complex issues who are really unwell, and in some places there's about half the staff is what there are with for us.
I think that those nurses would feel horrifically disappointed because they're working, in outlying areas with not a lot of support. And they do a wonderful job, and the people that they look after are not getting the quality of care which they deserve. It's not humane. It's not looking at the people of New South Wales and the quality of care that they deserve.
No, Mr. Ayres wasn't here at all. It was when they took the letter and we kind of marched in behind to, well, if you're not going to reply to our kind of attempts to speak with you, then the here nurses and midwives will come and knock on your door.
Come and talk to us. He's never turned up once. Next time, let's hope he comes and talks to us and maybe represent us.
We need to continue to fight this government for a fair and just health system.